Hi, everyone, and welcome. My name is Carrie Molkowski. I am the Director of Education at FAIR, and I am delighted to be your moderator for today's discussion around accommodating students with food allergies. Before we get started, and I have the pleasure of introducing today's presenters who you see on your screen, I just wanted to go over a few quick things. Please note that for maintaining a quality recording, all attendees joining us today are going to be muted throughout the presentation. However, this is definitely not going to stop you from joining in on the discussion today. Everyone should see a Zoom toolbar. It's in black and it should be at the bottom of your screen. So specifically in this toolbar, you'll see a little Q&A button. You can use this to communicate directly with me. Please let me know if you're having any technical difficulties, and I'll do my best to help you out. But most importantly, you can also use this feature to ask questions. Now, we won't be able to get to all of them, but we've built in some time at the end of the discussion for a few moderated questions. So please feel free to send them my way at any time throughout the presentation. And again, if time permits at the end, we will pass them along to our presenters. I also wanted to say that both of these expert panelists joining us here today are not representing their schools or employers in this presentation. So with that said, it is my pleasure to introduce today's presenters whom you see on the screen. We've got Cathy Rasher and Elizabeth McDermott. Elizabeth started her career in education as a middle and high school science teacher. She has been a nurse for 26 years and a school nurse for the past 21 years. She is the nurse on Georgetown Day School's PK through 8 campus. Georgetown Day has a large number of students with food allergies and actually has never had a cafeteria. Students eat in their classrooms. Elizabeth has been very active in instituting protocols to keep them safe. She has a severe food allergy and is the mother of a child who had a severe food allergy until age 4. Elizabeth served 2 terms as the president of the District of Columbia School Nurses Association and recently finished a term on the board of directors for the National Association of School Nurses. Joining Elizabeth, we have Cathy Rasher. Cathy has been a registered nurse for 44 years, working mainly in oncology prior to coming to school health. She has worked in school health in the District of Columbia since 1993, first as a school nurse for 16 years, then for 6 years as a nurse manager, and most recently as a nurse case manager. The continually evolving healthcare challenges of children in school have led her to case management, where she can actively coordinate the care of students with medical needs to allow them to function to their greatest potential in the academic setting. So at this time, it is my pleasure to turn the presentation over to Elizabeth to get things started.
Thank you, Carrie, and welcome to all of you out in Zoom land. Thank you for joining us today. Our goals today are to help you to understand that accommodating students with food allergies is often much more complex than you may realize, and also to send you off with some concrete actions that you can take to help keep your child or your students with food allergies safe at school, especially during this COVID epidemic. In the interest of time, I'm going to skip over our agenda because I want us to have time for questions at the end, and start today with what a school nurse does. And I realize that you're coming from different schools throughout the country, and some schools have a nurse in the school, some schools may have a nurse overseeing the school, and unfortunately there are still schools in this country without nurses, but I'm coming at this from a nurse's perspective today. And I think a lot of people think that we sit in our offices all day waiting for somebody to vomit or to fall on the playground. And if that was ever true, it's not anymore. I think our most important job is care coordination, and we are actually the bridge between the medical community and the educational community. So our job is to ensure that children are safe and receiving medical care that they need at school and outside of school, and then helping to ensure that they get appropriate educational accommodations in the educational setting. And many of your nurses are not sitting in their offices all day. We are out and about, we're observing children in the classroom, we're consulting with teachers, we're doing staff in services, we're at your 504 meetings, hopefully, or your IEP meetings. And while we're in our offices, we are, doing the things you do think of probably, right? The screenings, first aid, assessing ill children, administering medications, doing procedures that you may not think of in a school setting, wound care, colostomy care, tube feedings. So the takeaway today in this is that our jobs are complex. We are busy, and we are not sitting in our offices waiting for your child to have an allergic reaction at school. So taking care of children with food allergies is really a team effort, and it really requires coordination between parents, teachers, physicians, nurses, and the students themselves. We have two different pieces of federal legislation that help us in advocating for your children, and more importantly, that protect your children. And these are IDEA, the Individuals with Disabilities Act, and Section 504. And both of these say that students with disabilities have the right to be educated in the least restrictive environment, and that they must receive reasonable accommodations while at school and during school-sponsored activities. Both of these apply to children with food allergies, as well as many, many other diagnoses. So now, in this day and age, we have very inclusive classrooms. And these offer advantages to all of the children, but they also mean that we are providing many different accommodations within the same classroom. And if you look today at a typical class in the United States of 25 children, on average, you are going to find 2 children with an asthma diagnosis, 2 children with a food allergy diagnosis, 3 children with an ADHD diagnosis, 4 children with a mental health diagnosis, and someone else with another diagnosis, whether it be a physical disability, diabetes, Crohn's, I mean, you name it. And this is where accommodating children with food allergies can get really complex. Sometimes these different disabilities result in competing priorities. And I find that those of you who have children with food allergies are wonderful about communicating. You want the school nurse to know what your kids' allergies are. You want the teachers to know. You want other parents and students to know. And rightly so, right? Because this protects your child. But that's not true of many other diagnoses. And we have parents that don't want teachers to know about their children's diagnosis, or other parents to know, or other children to know. And we have these same children in the class with your children, and we are equally and legally responsible for accommodating these children too. So I'm going to share an example with you today, just to give you an idea of what we're dealing with in a class. I had a child I worked with who was diagnosed with infantile and then eventually juvenile anorexia. And the bottom line was, this little guy didn't eat from the time he was born. He was tube fed. And they finally got him to start eating. And the only thing he would eat was peanut butter cups. So I have this child in a class, and I have an order that I am supposed to feed him peanut butter cups anytime he asks for them. And actually, we're supposed to encourage him to eat them throughout the day. We're trying to get this child to eat. And I have him in a classroom with a number of kids with severe peanut allergies. So their parents don't want people eating peanuts in the classroom. I have to feed him peanuts. I can't tell them why. And this was something we were able to work out. We fed him regularly, and at the same time kept those children with peanut allergies safe in that classroom. But this is just one example. And I could give you many more. I'm actually going to skip this slide in the interest of time, but just know that other things that may conflict with food allergies are autism. We have a lot of children in schools with autism who have very specific eating needs. Children with diabetes or ADHD that may need to eat frequently throughout the day. We're going to talk mostly today about kids, obviously, with food allergies, because that's why we're here. And what are reasonable accommodations in the school setting? So the first one is having epinephrine available. And I'm speaking about the epinephrine that you're asked to bring in at the beginning of the year. Cathy's going to talk later about stock epinephrine. But this should be available at all times to your child on campus and on off-campus activities. And it should be easily available. So it should not be locked up in a locked file cabinet in the nurse's locked office. It's got to be somewhere where people who can administer epinephrine can have access to it should your child need it. We need to ensure that staff have your child's action plan. And this should be given out before school starts so that everybody knows that your child has a food allergy. And I'm talking everyone who works with your child, not just their homeroom teacher or their advisor in a high school situation. And all of these people need to be trained in recognizing the signs and symptoms of anaphylaxis and in epinephrine administration. We need to ensure that you have safe allergy labeling in cafeterias. And this year, we're going to be bringing food to the classrooms. So your child's not going to be picking in the cafeteria. So you should have access to this ahead of time so you know what's being served. You can help make decisions about what is appropriate for your child and it's not, whether you need to send their lunch or that's safe for them to eat. These labels should be something that children can see too, because we want them to start self-advocating. So you see that I have down here some of the symbols. Some schools may also use color coding for really young children or children with disabilities, so that they know that they can eat anything that's labeled with green or whatever, but easily read labels. Safe seating arrangements, and we're going to spend a lot of time talking about that in just a moment. Hand washing after eating to remove food proteins. Not requiring students with food allergies to assist in cleanup after meals. Advance notice of parties and celebrations when possible. And I want to stress when possible. Schools are environments where things change quickly. Sometimes we have parties that are a surprise that a teacher may not know about. Or somebody shows up with birthday cupcakes one day and we didn't realize they were coming in. So, when possible, teachers should notify you about class celebrations. But I always suggest in my school that parents of kids with food allergies bring in something at the beginning of the year that their kid really likes. So that if we get a surprise party or something, we have something safe we can pull out for that child that's going to be special for them and they never feel left out. We need to ensure that your child is not exposed to allergens outside of food service. And Cathy's going to talk about this later as well. What I also want to talk about is what is not a reasonable accommodation for a child with food allergies. And what is not reasonable is asking that your child's classroom or school be free of his or her allergen. And there are three real reasons for this. The first one is the world is not allergy free. And as parents, you have a responsibility to teach your child how to navigate the real world. And as educational institutions, we have a responsibility to teach your child how to navigate in the real world. And just as importantly, we need to teach people who don't have food allergies how serious they are and to teach them to be allies to people who have food allergies. And so having a school where you have allergens present allows you to have these discussions, to teach people these things, and it's going to make everybody safer in the end. Secondly, research indicates that children who attend schools that are allergen free, and I put that in quotes, are much more likely to have reactions, or as likely, depending on which studies you look at, than those who are attending schools that are not allergy free. So your child is not more safe when their allergens are not in the school, in an allergy free school. Because I think these schools become complacent, right? They think that it's all okay. They're allergy free, and you can never be allergy free. So it's much better to allow those in and to institute protocols to protect children. And finally, as we talked about earlier, there may very well be competing accommodations in your child's class, or even other food allergies in your child's class. Your child may not be able to eat peanuts, but may exist only on pizza, and yet somebody else in the class has a milk allergy, and they don't want milk in the classroom. So there are competing reasons why this doesn't work. So let's talk now about COVID. The CDC and the Departments of Health are recommending next year that schools keep kids in cohorts, in small groups, and this is to prevent the spread of COVID. It makes contact tracing easier, right? If we get COVID in a particular class, we're less likely to spread it around the building if children aren't interacting with each other. But that's going to mean eating in the classrooms. And I know FAIR put out a survey recently, and they asked parents what they were most worried about for next year, and people were saying eating in the classrooms. And as somebody who has been working in a school without a cafeteria for 21 years, I can tell you that it is absolutely easy to keep children safe in a classroom. It's just going to take some changes in the way that we do things and the way that we think. And the first thing is training teachers. And I know in a lot of schools, the nurse is trained to administer epinephrine and maybe 2 or 3 other people in the school. And I think that next year, this training is going to have to be much broader. I suspect we're going to have a lot of changes in personnel next year. We're going to have teachers out because they're asked to quarantine or to isolate. And it may not be the teacher who is exposed, but maybe somebody in their family, and so they have to stay home. So we're going to have people in and out of classrooms next year, substitutes, other teachers covering for each other. We're not going to be able to depend on the cafeteria lady to recognize anaphylaxis and administer epinephrine. It's going to be whoever's with your child. And that we don't know who's going to be eating lunch with your child next year. So we need to be training everyone in the signs and symptoms of anaphylaxis and administering epinephrine. The other thing that we need to do differently is we need to have change the way we do seating. And I know that in a lot of schools, in a cafeteria, you have tables that children with food allergies go to eat to keep them safe. So they are separated from the rest of the children during lunch. And this is not going to work in a classroom setting. I can tell you right now. What you need to do is just the opposite. We need to put children who are eating food allergens together at the table. And this does a number of things. One is it's going to contain the allergens to a particular place in the room. So instead of having people eating peanuts, nuts, eggs, whatever, all over the room, they're eating them in one particular area. So the allergens are contained. It also, I have to tell you, it cuts down on the number of allergens, because if your child is best friends with somebody who's allergic to peanut butter, they're not going to want to bring peanut butter to school or to peanuts to school, because they're going to want to sit near their friend. And they're not going to be able to if they have those. So it cuts down on the number of allergens that come in. And also students who have allergies know where it is safe to sit in the classroom and where it is not safe to sit in the classroom. So these are some signs we use at our school that I got from the lower school, our younger kids. And you can see that they're graphic, they're pictures, they're very easy for kids to see. That if they are eating peanuts, tree nuts, eggs, that they need to sit at this particular table. And these signs, when you walk in, are hung from the ceiling so that when you walk into the room, you're very aware of where the area is where these things are eaten. And they're also placed on the tabletops. This is a sign that's used in the middle school. And you can see that this has a little more writing on it because obviously these kids can read. This takes a little bit of creativity on the part of the nurse and the teachers, because we've got to kind of figure out what allergies are there and how we're going to separate kids and what tables are going to be what allergens. But it's very doable. It just takes a little bit of thought. And I will tell you that we do this even in classes where there are no allergies. So let's say I have a class and none of my students have allergies. I am still going to have allergen tables in my classroom for lunch and snack. And the reason for this is kids switch classes, right? Especially in your high school or your middle school. There may be nobody in my lunch group that has an allergy, but my next English class that comes in, I have somebody who's allergic to peanuts. So that child needs to know where is safe in the classroom to eat. So this is done in every classroom, regardless of whether there are allergies in that classroom. And also in the lower school, you know, they may, if they, in your after school program, if it's raining, they'll bring kids into a classroom or whatever. You want to make sure that every classroom is safe. These tables are cleaned, all of our tables are cleaned after lunch with disposable towels. And we use 409, you can use soap and water, you can use whatever you're using to scrub proteins off of a table. I know it's not eco-friendly, but when you're using a sponge, when you're using a rag, from table to table, you're just transferring food proteins. So it really needs to be done with disposable items. And then on these allergy tables are washed again by a teacher. So they're really getting a double cleaning, and we wash the tabletop, the chairs where people touch, and just scrub that off after eating. And does it take some time? Yes, it does, but that's going to have to be our reality next year. We also never ask children with food allergies to clean tables. There's plenty of other jobs that they can do. Oops. Wait a minute, I'm sorry. We have a very strict policy about not sharing food in our school, and I think this is going to be really important to enforce next year. When children are not eating in the cafeteria, their meals are going to be brought to them, self-contained. If somebody forgets their lunch, who was supposed to bring it, they're going to need something to eat. If somebody drops their lunch on the floor, and you would not believe how many kids drop their lunch on their floor every day. It's not like they can just walk back up to the cafeteria line and get another one, right? Or those kids that they're coming pre-packaged, the kids are still hungry afterwards. They're going to need something else to eat. They can't go back through the cafeteria line again this year. So it's important to have extra food in the classroom that is free of all the major allergens, so that if a child needs something else to eat, they can get it from the teacher and they're not sharing with friends. The other thing we do is we have everyone wash their hands after they eat. We're going to be washing our hands a lot next year, but it's really important that we wash after we eat to remove any food proteins from our hands. If classrooms don't have a sink in them, we have baskets on the tables that have wipes in them, because we know that hand sanitizer is not going to remove food proteins. So we have baskets of wipes, and the kids wipe their hands thoroughly when they get done eating. And we talked earlier about how taking care of children with food allergies is a team effort. And the rest of this presentation, we're going to talk about what your school nurse or whoever the medical person is at your school, what their role is, what the physician's role is, and then what your role as a parent is in keeping your child safe at school. So the first thing your school nurse should be doing is working with you and your child's physician to obtain the proper orders and medications before the start of school, so that when your child walks in the first day, we are ready for your child. We need to ensure that your child's epinephrine is stored appropriately, as we said, so it's accessible to everyone, and that we're tracking the expiration date of that. We need to alert all faculty and subs to your child's allergy. And the subs are going to be really important next year, because I think we're going to have a lot of them in schools, and they need to know about your child's allergy. And again, everyone who works with your child, whether it's the librarian, the learning specialist, whomever, they all need to know about your child's allergy. We need to make sure that we are developing protocols to keep your child safe, and we just talked about some of those. That can be put into effect to keep your child safe while eating in the classroom. We need to educate faculty and staff regarding the signs and symptoms of anaphylaxis. We need to train staff in administering epinephrine. I will say I train every adult body in my school, whether it is the principal, the secretary, the teacher, the bus driver, the maintenance man, the custodian. Every adult in my school is trained, because I don't know who's going to be in your child's lunchroom when they have a reaction, or who's going to meet your child in the hall when they're having a reaction. So every adult in our school is trained. We also need to ensure, and then this goes along with it, ensuring there's a backup plan if the nurse is not there. If every adult is in the school is trained, it's okay that your nurse is not there. And finally, we need to teach children to self-advocate. And we need to create an environment in which they can safely do that, where they're not going to be bullied for doing it, and where they have allies who will help advocate for them. And Cathy's going to talk more about this as well. Finally, I want to talk about the physician or the nurse practitioner's role, and I know we have some of them registered today, but also parents. This is important for you as well. It's very important that your child's medical practitioner documents their allergies on the physical. Nurses get those physicals in during the summer usually, and usually before we get your child's action plan. So knowing that your child has an allergy allows us to plan for your child. It allows us to reach out to you to ensure that we get in that allergy plan and that epinephrine. It allows us to make plans for your child. In a lot of states, school nurses can't delegate medication and they may have to go on field trips or make arrangements to do so. So this helps us plan for field trips. It also sometimes affects class placement. We may have teachers that are better at dealing with food allergies than others, and we may actually ask to have your child placed in a different class because we know they have a food allergy. So we need to know this. And I've been reviewing health forms all summer, and I cannot tell you how many I've gotten that say well child written on them. And I know this child has food allergies, has asthma, has diabetes. You know, please document children's medical issues on those physicals. Those are for the nurses. They're not published in any school directory or anything. They're for us, and we need those to plan safely, to plan safe care. Parents, it is your responsibility to take that action plan with you to the doctor. And even if your child sees an allergist, if you're going to see your pediatrician, take it in. I'd rather get 2 of them back than have none of them. And I would suggest that pediatricians should actually keep those in their offices. So if a parent forgets, you can have that to give them, because you know we are going to be asking for this. So get it done and get it to those parents. When prescribing epinephrine, please ask whether the school prefers a particular brand. There are multiple epinephrine delivery devices on the market right now, and they all work a little bit differently. Same medicine, different way to work them. And it's becoming a little onerous to train teachers in multiple delivery devices. I will tell you, for example, I do not allow the 2 brands that have exposed needles at my school because I think it is a hazard to have exposed needles. I don't know why we're allowing those in schools, but I don't accept them. So check to see if your school has any rules like that. Write for multiple packs. Parents, please go to the doctor ready to tell them how many EpiPens, ABQs, whatever you get, how many you need. And doctors, ask about that. Families need them for at home, and they need them for school. We can't move them back and forth between those 2 places, so they're going to have separate ones. Some schools, I know, have separate after-school programs that are run by contractors, and the nurses can't give them their epinephrine. So they may need a whole different set for after school. They may need it for a sports activity outside of school, or maybe they go between 2 houses and they need them for each of their houses. So please find out how many delivery devices your patient needs. Alert them to the coupon programs. These are so expensive, and it really does help patients. And I find so many of my parents don't know about them until I tell them. And finally, please, please, please be careful about writing for Benadryl on the action plans. Schools are very different environments than homes and health offices. Parents know their children. They know what their reactions look like, and they have the time to observe their children. Same thing in a healthcare provider's office. When children come to me, I am trained to observe them. So if I see a mild reaction, I may watch them. I may give them Benadryl, but at the same time, I'm listening to their lungs. I'm checking their oxygen saturations. I'm taking their blood pressure every few minutes. I am watching this child very closely. We cannot ask other people that are non-medical professionals to do that. And remember, in schools, we are delegating epinephrine administration to teachers, to med techs that work in a lot of the offices. These are not trained medical professionals. and they are not able to assess. So they are told, do not delegate Benadryl to them. We tell them, if you think a child is having an allergic reaction, administer epi and call 911. When you fill out an action plan, you're not really filling it out for the nurse. We have standing orders that govern what we do and training. You're filling this out for unlicensed professionals. You're filling it out for health aides, you're filling it out for teachers, and they should not be giving Benadryl. I put this picture up here because it reminds us that Benadryl is, if you have a leak in a pipe, Benadryl is like mopping up the water, right? It's helping, but it's not going to stop an anaphylactic reaction. Only epinephrine is going to stop an anaphylactic reaction. And that's like turning the water off at its source. And that's what you want to do when you have a leak, right? You go down, you turn off the water at the source. You don't rely on mopping. We should not be putting Benadryl on care plans or on action plans for children. And I'm now going to turn this over to Cathy, who's going to talk about what you parents need to be doing as part of this partnership.
Good afternoon. Now we're going to talk some more about the role of parents of a child with food allergies. Okay, kids need to know the facts, really plain and simple. This isn't a time to be subtle or ambiguous, and you need to be a role model when advocating for your child so that they learn to speak up for themselves as they grow. The more they know and understand, the safer they'll be in school. We'll return to this in detail a little bit later on. Next slide. Okay, dealing with your child's school requires total transparency. Has your child been tested for allergies, or has a sensitivity been noticed for some foods? And when have they had a reaction? Has it been lately? And what were the circumstances? Where were they? Let the school know how your child looked during a reaction. Did they have hives? Were they flushed? Were they very anxious? Exactly what did they look like? And how sensitive are they? Must they actually eat what they're allergic to? Or does having skin contact cause a reaction? Now keep in mind, children ages 2 to 5 touch their eyes, nose, mouth, and ears about 40 times per hour. So actually that skin is in the mouth a whole lot. Now with changes due to COVID, as Elizabeth said, most kids will be eating in their classroom this year, so it's important more than ever to make sure that this information about your child is available not only to the classroom teacher, but whomever may be covering the class during meals and any possible substitutes. Next slide. Now, you all know the traditional symptoms of an allergic reaction, but what does your child say? If they happen to have asthma also, which many kids with food allergies do they mistake symptoms for one another? It could be easy to do. Now, my nephew, when he was young, got something in his eye. And instead of saying the word, "it stings," he said, "My eye is sour. It is so sour," like a lemon. So kids will say different things. The typical symptoms, shortness of breath and wheezing, or a tight or hoarse throat. Your child may say instead, "My tongue is itchy, my stomach aches," or "I think I'm having an asthma attack," or "I just don't feel good." Symptoms, each child is truly unique. Next slide. So symptoms can be visible and dramatic, like audible wheezing, panicked appearance, swollen lips and tongue, or very subtle, like an upset stomach. Not every child looks alike during an anaphylactic reaction. The child on the left obviously has swollen lips, hives, is probably in distress. The one on the right just doesn't feel good. One size doesn't fit all, and the situations are not black and white. Next slide. Now, like the old TV shows, a child needs an A team at school, their anaphylaxis team. When I worked in an elementary school where I had dozens of kids with asthma, I had an asthma club where we created each child's A team for their asthma. Now, you're the captain of your child's anaphylaxis team. Their first line of defense, their defensive coordinator. Can you tell how much I miss sports? Of course, your physician does the testing and prescribes the appropriate medications, and your school nurse is there to assess, educate, safeguard your child, and administer emergency medication if needed. But please keep in mind that the lay people in the school, as Elizabeth said, are not trained to assess your child in the event of an emergency. They don't listen to their lungs or take blood pressures. but they've been trained to give emergency medication. So they need to be part of this team. And who else would you have on your team? A really important person to me was always the custodian. They're usually in the cafeteria at lunchtime, and they'll see if that child is picking up a shared dishcloth to wipe tables instead of using disinfecting wipes when there is an allergy-free table. Now, my custodians were awesome. And keep in mind, people like school caregivers, after-school caregivers, and other folks in your school that are coming into contact with your child. They should all be part of that A team. Next slide. It's very important to have more than a hallway chat with the school nurse. Of course, you want to talk about the specifics of your child's allergies and symptoms, but does your child have any other medical conditions? Does your child also have asthma? That may mimic some anaphylactic symptoms. And what about diabetes? A child with anaphylaxis and a child with diabetes may both present to the school nurse with stomach aches, but they may be serious for totally different reasons. I had one student with both severe food allergies and diabetes, and when she did not feel well for any reason, I had to do a quick and thorough assessment to keep her safe. And just as an aside here, I have to throw this in. Elizabeth and I believe that every child needs a school nurse. There should be a licensed nurse in every school. Back to my slide, I'm sorry. Please consent to share information. Information is shared on a need-to-know basis at school, not with people who don't need to know, but it's important, very important for a child with anaphylaxis. And also, let your school nurse know if your child has been to the emergency department recently for anaphylaxis or admitted to the hospital, and what prompted the visit. What was the treatment? Did their orders change? And again, plan B. If the nurse or another trained person is not around, what's your plan? Next slide. I'm sorry, next slide. Okay. Okay, now, what medication to give is a judgment only the nurse can make in the school setting, which is why Elizabeth brought up the Benadryl earlier, because lay people are never trained to give Benadryl. It's always safer to go straight to the epinephrine, and as the only thing that we teach lay medication givers. It's also important to know that for the safety of your child, in the event of suspected anaphylaxis, nurses will call EMS first, and the parents will be called second. We want that ambulance on the way as quickly as possible. And you want to always make sure that your child has had a face-to-face meeting with the school nurse when school starts. But with so many kids and so many diagnoses and so much medication given in school these days, your child's picture on their medication orders can save precious minutes. Children experiencing anaphylaxis are usually anxious, they are scared, they may have difficulty explaining themselves to a medication giver, and the medication giver, if they don't know them, wants to make sure they treat the correct child with the correct medication promptly. Seconds do count. Next slide. Now I'd like to talk a little more about the 504. This can be initiated by you, the school nurse, the 504 coordinator. Even your physician may be the one to recommend 504. The 504 is really the best opportunity to advocate for your child and their very specific needs. With COVID, right now, many in-person meetings are postponed or canceled. Don't let your 504 be postponed. Use Zoom, use Skype, or whatever platform you can use to make sure these meetings take place. In addition to the attendees that I have up on the slide, for middle and high school students, I ask that they attend also. They have more buy-in if they're sitting in the room, and it's an excellent opportunity to learn self-advocacy. Now, training in epinephrine administration is now available to most school staff, but it is not mandatory. It's frequently an online training that, again, does not include assessment skills or any sort of certification, just the mechanics of using the medication delivery system. In Elizabeth's school, as she mentioned, she trains all adults in epinephrine administration, and that's the gold standard, but it's not the norm. Request training for as many staff members as possible during your 504. Next slide. Now, these are some further discussion items for the 504. Elizabeth had excellent suggestions for how to manage eating in the classroom safely, but you want to make sure that there's education for all staff. Posters in the classroom, the cafeteria, special subject rooms. You want to make sure that the staff knows of your child's specific signs and symptoms of a reaction. And are there safe snacks in the classroom? Are there ever food projects in the classroom? I know everyone's got macaroni pictures stuffed up in their attic somewhere. And seating in the cafeteria, if we still use cafeterias, how will that look during COVID? Will there be designated tables? What are the tables cleaned with? Put it in your 504. Make sure it's there in writing, so it must be followed. And keep in mind, as Plan B has been brought up a number of times now, that not all schools have nurses. In many communities in the United States, one nurse services many schools, and there may only be a health tech when there is no nurse. If this is your situation, meet with the health tech and others responsible for providing health services in the school. They should also attend your 504. Next slide. Okay, some additional accommodations. Now, a fire drill is not really an emergency. It's a drill and the kids are back in the classroom very quickly, but a real fire is an emergency. What is the plan if the school is evacuated to another location? Who is responsible for picking up and bringing the emergency medications along, such as EpiPens, insulin, and inhalers? And what happens if there's a bigger emergency? We're here in Washington, D.C., and we always think about the worst case scenarios here, such as a terrorist attack. Now, in this case, the school could be on lockdown for an extended length of time, may go well beyond the school day. Is there a supply of safe food for your child in the event of a lockdown that extends beyond the school day or even into the next day? And field trips, they may not be a big deal this year because of COVID, but things could change throughout the year, so include this in your 504 plan. School nurses rarely go on field trips because they are responsible for all the kids in the school, not just the kids on that field trip. And if there are field trips, remind the person carrying the epinephrine that it cannot be left in a hot car. Too often I've had staff members go on a field trip on Friday and toss their first aid kits and the medications into their car and bring it back on Monday. If it's too hot, the effectiveness of epinephrine is compromised and we have to destroy it. Now, cold, on the other hand, even freezing doesn't have the same detrimental effect. Next slide. So a little bit about special subjects. There are potential allergens in art and music and science. They use empty egg cartons, yogurt containers, etc. And even though paper mache isn't very tasty, those little fingers go to the mouth, nose, and eyes about 40 times per hour. Other things that can be used that show up in art are candy, pretzels, seeds, marshmallows, graham crackers, beans, rice. Make sure you talk to your art and science and music teacher about their plans for projects during the school year and ask that they call you if they are unsure about any item to be used. Now, due to COVID, special subjects may be taught in the classroom this year, so they don't have students moving to different rooms. So check with the classroom teacher if he or she will be planning any projects using food. Next slide. Here I want to touch on privacy and confidentiality versus safety. While kids are young and unable to advocate for themselves, I definitely recommend being very open with parents, friends, and classmates. I recommend that you work very closely with your room parents, or better yet, be a room parent so you'll have more say in what events go on in that class. Will there be parties? Will birthdays have treats come from home? On field day, if there is one this year, what refreshments will they have and where will they be eaten? And understand that policies differ from school to school. Some schools allow no food brought from home because even if the item brought in contains no allergens, there's always potential for cross-contamination, such as a cutting board being used for cutting a peanut butter sandwich just before those peanut-free sugar cookies are being rolled out on the same board. Next slide. And look beyond your school day. Will your child be going to before or after care? Sports, clubs, activity, is someone there trained in epinephrine administration? What about play dates? Do other parents know your child's allergies? And is there epinephrine available if they go to someone's house? Is your child bringing an EpiPen in their backpack? And think about carpools and buses in the same vein. Next slide. I'm a case manager now, and I work with both public and public charter schools in DC. I spend a lot of time recreating health records that never transferred with kids that go between schools. Please keep copies of everything you give to the school in case it goes missing or does not transfer with your child. Don't give health or medication forms to anyone but the school nurse or the designated health services provider for the school. Documents sent in backpacks or dropped off in the main office or with the teacher can get lost in the myriad of papers that come into the school. If you absolutely must send important documents with your child, put them in a well-marked envelope for the school nurse and follow up with a call to make sure that she or he received them. And I want to just touch on stock epinephrine. In our schools now, we do have stock epinephrine, but it's meant for children with undiagnosed food allergies. A child who suddenly is eating peanuts in the cafeteria and begins to have symptoms of an allergy, symptoms of anaphylaxis. We have epinephrine for that child, but you need to make sure that you have epinephrine there specifically for your child, ordered by you. Don't depend on the stock epinephrine because maybe it was used yesterday and not replaced. Maybe it's expired. That stock epinephrine is not checked as closely by the school nurse as the medications that we keep in the health suite are. And the world is not allergen free. So, next slide. Educate your child. Educating your child should not involve scaring them. It needs to be very matter of fact. I don't drive a car with my eyes shut because I would crash. I don't play with cats because they make me sneeze, cough, and itch. I don't play in the street because I could get hurt. I don't eat peanuts because they make me sick. Don't let your child define themselves around the allergy. It's just part of their life. A serious part, to be sure, but it shouldn't be a paralyzing part if handled properly. Next slide. Talk to your school nurse about what your child knows and understands so that you two can reinforce the messages going between home and school. Be on the same page. Does your child say, my tongue itches, like I was saying before? What language do they use when they've had a reaction? Now, as kids get older, the language becomes precise and specific, but younger kids are really a challenge. So partner with your school nurse and bring your child into that conversation. Gear the education to your child's age and developmental stage. There's a lot of material out there for various age groups. Use it so your child's getting what they need at the level they can understand. And health literacy in anaphylaxis requires that you and your child know the signs and symptoms of the condition and how to describe them. As mentioned earlier, a child won't say, well, I just had emesis. They will use terms like, I hurled, I barfed. You do need to tell the nurse and other key people the words that your child uses, and then together you can make a care plan to maximize your child's safety at school. Next slide. Teach your child to recognize their signs and symptoms, not to share food, to notify an adult if they think they've been exposed to anything that's making them feel funny or if something feels wrong. Avoidance strategies, which may be having their own snacks from home in the event of a party or an unplanned event involving food. Helping them keep their hands away from their eyes, nose, and mouth, which is coming secondary with COVID now. We're doing that a lot more. To wash their hands, not use the antibacterial gel after eating, and to report any food-related bullying. How many of you remember the slogan, just say no? It was meant for drugs, but it's not a bad slogan for food allergies either. Kids with food allergies have to be taught to say no to offers of food from even their best friend. Their best friend will say, no, my mom baked these cookies. I know there are no nuts, but that's not always the case. So, and of course, just to repeat, your child should never, ever hesitate to tell someone if they're unsure if they may have eaten something that they're allergic to, or if they feel funny. It's just better safe than sorry. Next slide. Okay, food labels. As the little cartoon says, allergy moms do better research than the FBI, and that's true. Obvious words to look for on a label would be contains, may contain, or processed in a plant that has peanuts, whatever. But there are many words to look for in a label, and you need to slowly introduce these words into your child's vocabulary. For instance, a child with a milk allergy should avoid casein, curds, galactose, quark, and whey. For fish allergies, of course, roe, but also surimi, agar, Worcestershire sauce, that's it, Caesar salad dressing, and sashimi. Read the labels together with your child when you shop. Create word finds on the computer. Let them be food detectives. And labels have changed a lot, so check carefully all labels and start teaching this to your child early and bring it up often. Build their knowledge, build their responsibility, and their self-confidence in dealing with their own food allergy. Next slide. Just a few other considerations. For developmentally delayed children, make the message simple, routine, and repeated often. And many children do not want to wear a medical alert bracelet, but for a child who is developmentally delayed, this can be a real lifesaver. And there are many types of alert bracelets now that are very lovely and look like bling. Use multiple strategies with kids who are developmentally delayed and with other children as well. FAIR has tons of info on their website. The Asthma and Allergy Foundation of America have basic activity books. There are online games from the American Academy of Allergy, Asthma, and Immunology. And there are many kid-oriented books about food allergies available through Amazon and other sources. And then there are teenagers, which is a whole other consideration. Teens have the highest risk of fatal food-induced anaphylaxis. For teens, they tend not to carry their medication with them. They give in to peer pressure, and they think they are invincible, and they are willing to take chances. I worked for a couple of years in the past few years with a high school student who wanted to do everything her friends did, and every week she ate pizza, although she was severely allergic to dairy products and wheat. She would eat the pizza, she'd pull her EpiPen, she would stick herself in the leg, and then she'd go to the emergency department because she wanted to fit in. She literally went through 3 to 4 EpiPens a month. And last but not least, kissing. What teen is going to ask their new love if they ate a peanut butter sandwich before that first kiss? So with that, this is the end of our presentation. We appreciate you attending, and I think we probably have time for a few questions. So I'm going to turn this back over to our facilitator, Carrie.
Wonderful. Thank you, Cathy and Elizabeth. And indeed, we have quite a few questions. And again, I apologize to all of our attendees. We probably only have time for just a few, but we're so thankful for your time today. And just to also let everyone know, the presentation is being recorded, so you'll be able to review it again. We'll send out the recording and the slides hopefully sometime next week. So just keep an eye on your inbox for that. Okay, so right to it. The first question we have, and I'm trying to group them, and this one actually is about grouping and kind of, seating and social distancing. And a couple people were just asking, with the social distancing guidelines, and students sitting at individual desks, is it really necessary to keep students with allergies grouped? And also if so, how will they be grouped, being socially distanced?
That's a really good question, and I think something that schools are grappling with right now. The current guidance is that we have children sitting 6 feet apart. So this may not be such an issue anymore, right? We're not going to be sitting at tables together in the cafeteria. We will probably have kids individual at desks, which is going to make eating in classrooms that much easier, actually. But I would recommend that we still have tables very clearly labeled. So if your child has a food allergy, that becomes their desk. that they are sitting at, and it is clearly labeled that, you know, that you don't eat those foods there, or other kids can be labeled that you can eat there, so that if there is class change, and I honestly don't see how we're going to get through high school and middle school without doing some changing of classes. That's something we are still grappling with at our school, right? It's kind of easy in an elementary level school where everybody stays in the same class all day. But as we're moving, I think it's going to be more important than ever that there be labeling so children know where things are safe. And I would err on the side of labeling tables where people are eating allergens, so that if your child with a food allergy goes into that room, they know that that table is one where they can eat, you know, that there's a table that's not labeled for peanuts or tree nuts or whatever where they can eat. So it is going to take some creativity, and I think it's something to talk to your school nurse about, to talk to the teachers about, and make sure that we are seating kids in a safe way at school. But you're right, they are not going to be sitting together anymore at lunch, at least for quite a while, I think.
Wonderful, thank you. We had a couple questions come in and comments just around training, and I know, Elizabeth, you were talking about really just the importance of every adult in the school being trained. And one attendee was mentioning just how their school does it so lackluster. It's just someone standing on the auditorium stage and a whole group just listening in for an hour. You know, are there any recommendations of, you know, additionally, like what should be covered in the training and who should be receiving it? And a couple people I thought was really smart. They mentioned, you know, the importance of training bus drivers, which I thought was, you know, a good point. So if you can just talk a little bit about training needs.
Absolutely. And I think this year is going to be different again because of COVID. I actually do in-person training. I would like to think I'm not really boring and I'm just standing there in front of the class, the room. I'd like to think I'm kind of fun and interesting, but I do in-person training, and I actually do return demonstrations. So everybody actually uses, I don't know if I'm allowed to say names of products, but everybody uses an EpiPen, everybody uses an AviQ, and are actually practicing with it during the training. Because I think it's one thing to tell someone how to do it. It's another thing to give it to them and actually let them do it a few times with a trainer, obviously. We're going to have difficulty with this year because of COVID, right? We're going to be doing a lot of our training on Zoom. I imagine that I am going to be reaching out to my faculty and in-servicing them over Zoom this year. And this is something I've been thinking a lot about. And I have been hoarding trainers so that I can actually give every teacher their own trainer, and they can practice with that. And I would suggest that that's something that parents, I think a lot of you probably have extra trainers at home, because whenever you order your delivery devices, you get a trainer with it, that you might reach out to the schools and offer those as donations to the schools, because I think we need to get them in the hands of all of our teachers, all of our bus drivers, and have them actually practice with them. That is so important. And I know a lot of schools just use a video and everybody logs onto a video, but to me, there's a huge difference between watching a video and having that in hand when you're doing the training.
That's,
Cathy?
yeah, it's on YouTube. The training is on YouTube if you want to look for it there. But I agree with Elizabeth that having a device in your hands to practice with is invaluable.
Great advice, thank you. And because we are at time, that was such a full presentation, I'm going to end it with this last question. You know, if you could provide any kind of advice, or what would you recommend that parents can do now to kind of prepare for the school year, you know, taking into consideration, we really don't know, you know, are they going back, you know, in person or virtually or a hybrid approach? But, you know, I bring it up because I've heard from some parents that actually did have 504s in place, and in those 504s, you know, they mentioned that their child's allergen would be out of the classroom. So a lot of parents are concerned that those won't be honored, you know, and I know you mentioned getting a 504 meeting might be difficult, but is there any kind of best practice or advice, you know, that you'd tell parents, you know, to kind of start doing now in preparation for the school year?
I would go ahead and do it just as though school were going to start as normal. Get those orders, get the medication, request the 504, and make sure that it happens. because things could all change in a month. COVID could just disappear in a month. Not that I think it will, but we could be back at school in October, in person with all the kids there. I would just get everything as though it was going to start on schedule.
I agree. I think even those schools, a lot of the schools in our area are coming out and saying we're going to be virtual until this gets better. We're going to be virtual until November. But I think this is going to be a really fluid year. So I think everyone needs to plan, even if your school has said they're going to be later, you know, that they're going back and get stuff in order now, because you may have short notice. And if you're in a private school, we don't do 504s and IEPs. I did them when I was in public school. But we do make all of those accommodations without all the official paperwork. And I really just encourage you, whether you're in private school or public school, to start reaching out now. Those of you who have not submitted your health forms that were due, like mine, by the way, if any of my parents are on here, they were due in May. If you haven't submitted them, it is the time to do it. Get in touch with submit your forms, get in touch with your nurses, schedule your children's appointments. And I know a lot of people are worried about going to doctor's offices right now. The American Academy of Pediatrics has made it very clear that they do believe children should be getting regular physicals and their immunizations. I know that a lot of practices have amazing protocols in place. I kind of like going to the doctor now because you don't have to wait anymore. They just whisk you in and get you out. So it's a good time to go, actually, and get your appointments taken care of. But please, don't wait till the last minute. And a lot of parents do. Every year I get somebody who comes in the first week of school and I had no idea their child had an allergy. They're new to my school and they show up with this bag full of stuff. And, please, if there was ever a year to get your things in on time and to make contact with your school professionals, this is the year.
Yeah, it's too unpredictable to take chances right now.
Completely agree. The unpredictability is definitely there. So thank you so much. And before I let all of our attendees go and wrap things up, I just want to, give a shout out to our FAIR patient registry. On the next slide, you'll see kind of information about FAIR's registry. Even in these extraordinary times of social distancing and canceled events, we can each all stay actively in support of food allergy and research through our registry. It's actually all online, and joining and completing surveys is easy, quick, and secure. So please check that out. It's fairregistry.org. And with that said, again, a huge thank you to Cathy and Elizabeth. I know for a fact you've been working all weekdays and nights and weekends, since this pandemic started. So we so appreciate your time with us today. And to all of our attendees, thank you so much for your great questions. This is a conversation that will be continuing throughout the next couple months. We'll have information on our website, and I have access to Cathy and Elizabeth. So if there's anything you'd like me to, reach out to them afterwards, I'm happy to. So again, thank you both so much for joining us today.
Thank you.
Thank you.